For 20 years, federal funding for the Children's Health Insurance Program, known as CHIP, has helped shrink the number of uninsured children in Florida to an all-time low. It has bipartisan support, and that's needed. That's rare these days. But as Congress's rush to pass tax reform last month, it somehow failed to renew the program. And now CHIP is set to run out of money by March, leaving 6,200 kids on the Suncoast without health coverage. ABC 7's Adam Cellini has more.
Hey.
Sarasota mother Bobby Pope can't work a full-time job after a 2-year battle with cancer. She relies on Medicaid to cover diabetes treatment for her 2 youngest boys.
Oh, I wouldn't be able to afford anything because I think like one vial of insulin is between $200–300.
Pope is lucky her kids don't need the Children's Health Insurance Program, or CHIP, which has covered children in Florida with household incomes too high for Medicaid since 1997. Dr. Patricia Blanco hoped the popular program would get another 5-year extension, but in September, U.S. lawmakers let the CHIP budget lapse, leaving 375,000 children in Florida at risk of losing coverage.
Just seeing that large amount of children uninsured suddenly would be devastating.
In the last 7 years, the rate of uninsured children in Florida dropped almost 10 percentage points to an all-time low of 6.2%, according to a Georgetown University report published in September. That same report states health coverage for children helps translate to success in school and better economic outcomes for themselves and their families.
That was such a win-win situation. So many families were so positively impacted by that. I can't tell you how many families just cannot afford health care, and the costs are rising.
Many of these families still pay monthly premiums for CHIP. And Bill Colgate, vice president of MCR Health Services, a nonprofit serving Manatee, Sarasota, and DeSoto counties, says they aren't the ones usually looking for handouts.
Often it is the working poor. So it's individuals that have jobs, but the job doesn't come with health insurance for their children, and they don't qualify for Medicaid because of their income. So it's really people stuck in a very, very difficult spot.
Without it, Colgate worries some families will turn to the emergency room, an even larger strain on taxpayers, or worse, avoid health care completely.
It's much better to get the health services before catastrophic health problems occur.
So how did this bipartisan program run into trouble? Keith Fitzgerald believes lawmakers focus too much on failed attempts to repeal and replace Obamacare.
Nobody is advocating that we get rid of S-CHIP or there's anything wrong with it, really. What happened is it got caught up in the politics of the budgetary process.
Republican leaders have refuted these claims. We asked Republican Congressman Vern Buchanan for comment, but his office could only send us a statement saying he is optimistic a bipartisan solution will be reached before Florida's funding expires, which could be in March. More politics surround the current bill to replenish CHIP, which proposes cuts to one Affordable Care Act fund and shortening the period to pay late premiums. Only 15 House Democrats approved that bill before it headed to the Senate, worried it's another attempt to undermine the Obama administration.
I just can't even believe that we would go backward in time like this. So hopefully, our legislatures will listen.
And how important was CHIP funding for Florida in particular? Well, their 2017 allotment from the federal government was $686 million, 4th highest in the nation. In the newsroom, Adam Cellini, ABC 7, your Suncoast News.